Welcome, everyone. I hope you're staying safe and alert. My name is Shreeya Tuladhar, and I'll be moderating this interview today on behalf of Voice for Youth. During this COVID-19 pandemic, our Voice for Youth team has been working with various leaders across the community to bring you as much awareness as possible. And I'm honored to have with me today an infectious diseases specialist, as well as medical director of a 650-bed skilled nursing facility, Dr. Sunita Parajuli. Thank you, Dr. Parajuli, for joining us here today. It's such a pleasure to have you here. I know it's a chaotic time, and I really appreciate you taking your time out to be with us.
Thank you so much, Shreya, for having me and inviting me to this. It's a great opportunity for me, and I'm humbled. Thank you again.
It was such a great time meeting you at our last Doctors on the Groove event. And at that time, I don't think any of us could have predicted the turn of events that have happened. So how has your life changed since we met?
Life has changed dramatically at different levels, personally as well as professionally. At that time, obviously, everything was normal. We were in this event. I was with my mom. I was with my family. I was visiting my friends and everyone. And then I guess around 2 weeks later, I think that's when that was mid-February. And then first week of March is when the first cases of COVID-19 happened in New York City. And then we saw the gradual change, and then it hit New York so bad mid-March, that after that, it is just something very, very unexpected. Even though I'm a physician, I was watching news. I was looking at what was going on in China and Europe. It still hit so hard because it came with such a big intensity for all of us that it was very unexpected. And personal level, a lot of stress, a lot of work. Professionally, a lot of huge responsibility. And then, not seeing family, not seeing friends. Everything has changed. And pretty much now what I do is COVID, COVID, COVID. It's like I breathe COVID, I live with COVID, I think of COVID in my dreams. I wake up thinking about what I'm going to say in a meeting. So it's like I pretty much am with COVID right this last month or so.
That's insane. I can't even imagine what that would be like. But as you talk about your change in schedule, what are you seeing? How many COVID patients are you seeing a day?
In the beginning, I was almost seeing like almost 20 to 30 new fevers cases, which were ultimately diagnosed with COVID. At this time right now, I'm still seeing about 10 to 15 cases, which are chronic, which are already diagnosed. And then we are, as a facility, we are seeing about still many. We still have like several, almost like 100 cases of COVID in the facility, and still new diagnosis of about 4 to 5 new cases every day.
So when we talk about new diagnosis, are you seeing any different symptoms than what we hear on the news? Is there anything that people need to be looking out for that's not normally been told?
We can go over the signs and symptoms of COVID. Most of them are still fevers, short cough, sore throat, shortness of breath. Some of them also have GI symptoms like diarrhea, nausea, vomiting, and something called loss of smell or loss of taste. And also that's probably something new that we've noticed. And then also loss of appetite and just body aches and not in general feeling well. Those are the majority of the symptoms. But also to remember that a lot of people are asymptomatic.
Right. When you talk about asymptomatic, it would mean that we may be carriers that may give it to our grandparents, our parents, and the like.
Exactly. And that part is very important to understand and disseminate to the community, is that a lot of pre-symptomatic or asymptomatic patients could be carriers, and they could be younger patients, and they could be transmitting it or exposing themselves to other people who could get the brunt of the disease and get very sick with the disease.
So when a person is being infected with that disease, what would be the standard treatment plan like?
Treatment plan, if they are in an outpatient setup, it would usually be just monitoring themselves, monitoring for fevers, hydrating themselves a lot, taking supplements like vitamins, which does help to some extent to boost immunity, moving about. If they're in a hospital, then sometimes they are so sick that They need IV fluids, intravenous fluids, or supportive hydration, and then supportive other antibiotics intravenously, or even higher level of care like oxygen or intubation and ventilation, which is talked about a lot in the news. So that's the spectrum of the diseases we see.
There is still cases coming in, like you said, but there is a huge lack of knowledge in our community, and it's mostly due to excess information. And a lot of social media platforms are posting about it. A lot of them are from sources that are not reliable. It's caused a lot of confusion in our community, especially in our Nepali community. So I'm going to be asking you a couple of questions that related directly to our community. So my first question is, our Nepali community in New York is comprised of various living situations. One of it is sharing rooms. What would you say to a person that has a roommate that has been infected? How can that person isolate themselves? How can the person that is infected isolate themselves? Should they go to the hospital? Should they stay home? What is your advice?
Those are very good questions and practical questions at community level. I think in New York, what happened is last 4 weeks or so, it was just a huge source of sick patients, right? So the hospitals were overwhelmed seeing sick patients. So we didn't even have enough test kits for patients who were outside. And what is being told still is that it's better to isolate and do not go to the hospital unless you are very sick, which means that, like, if you feel short of breath, or if you if you're really sick, basically short of breath. And someone told me blue nails yesterday. I think when we were having a conversation, you mentioned blue nails. That's like the extreme point. But this disease has a various degree of presentation, from being asymptomatic to presenting as fevers, shortness of breath, cough, sore throat. But once you feel short of breath, that's definitely a point when you need to go to the ER. In a community where there are several people living together, if you are sharing a room with a roommate, then pretty much the other person is 100% exposed to this virus if one person is already diagnosed with it or has shown symptoms of it. So both of them most likely already have it, and that's why both of them need to be isolated. And again, still the approach is the same. If you're feeling sick, because there is not really much of treatment that you can get for this unless you're very sick. It would be high flow nasal flow oxygen, or it would be a ventilator or some form of supportive treatment in the hospital, only if you're very sick. So if you're not in that level, then it's still recommended to stay at home, hydrate yourself, try to move, because then you could have complications like clots if you don't. Move out of the bed, drink, hydrate yourself, take supplements. I think supplements are still good to boost your immune system. Eat regularly, and then and sharing roommate is a very, very difficult kind of situation in the community. It's hard to leave the room if you're already sharing. Where would you go? In that situation, I think if someone is younger, and if they are, hopefully they are going to get out of this easily, get out of COVID easily, but they should not be exposing themselves to others so that others do not get it. But if someone is elderly, that person probably is going to be affected by this, and at that point probably it's too late. So that person should definitely monitor themselves, because the problem with COVID is that it could transmit when you're asymptomatic or pre-symptomatic. So if a roommate could have been already exposed. So it's a very tricky question, right? Tricky thing to do in the community if you don't have anywhere to go. But these are the things you could do.
Going off the previous question, there's also a lot of speculation going on about age. In your experience, is there any validation to the claim that young people are still not likely to be infected?
I think the huge data supports that most of this virus usually affects like mostly adults, more than 20-year-old or 20 and above. Before this in China, they mostly said that it was like pretty much only elderly were being affected, but we did not see that trend in Europe or in US. We actually saw a lot of people getting infected above 20 years old. So even, 21, 30, 35, 30 years old getting very sick, which is a different trend. But in terms of younger kids, we haven't seen that often. There might be outliers. You will hear in news that there will be like, one or two cases who are young, might have gotten exposed to it, got mild kind of illness and got tested and was COVID positive, but it's not very common to see that. Still, we haven't seen high mortality or even like morbidity in kids, which is very interesting, and that area is still very intriguing to everyone, and I think that it will need a lot of research. But the younger kids or younger population could definitely contract it, even though they do not show symptoms. They could contract it and they could transmit it to the adult population or elderly population or people who are immunocompromised, and that's when they would affect them significantly.
As you were saying about like immunocompromised, when a person is infected, what does the recovery look like? And does age have a factor at all in that recovery?
Yeah, I think age has a huge factor in recovery. A lot of things, if someone does contract a disease, there are several things that would help them fight this. Age, just in general, if you're elderly, like a person who is 50-year-old without medical problems and a person who is 20-year-old without any other medical problems, a 20-year-old is going to fight it better. Just that's just a general fact. But if there is someone who has, in addition to that, other comorbidities, then that person is going to be significantly affected by it because they are not able to develop the immune response to fight this infection. And these people are going to be affected really hard. And usually what we see is that almost about 80%, which is holding still true, about 80% of the population are still showing very mild symptoms. But I think as we get more data, we will know more, and it might be even more than that, because this virus is so transmittable to everyone that it affects a huge population. And right now we don't have a lot of data in mild population, but what we see is that it affects it. Majority will have only mild symptoms. The ones who are getting the severe illness like shortness of breath or respiratory failure, those are patients who are elderly or comorbidities or are smokers. Now, it's not like we are not seeing younger population, 30-year-old without any medical problem being affected. We are seeing that too. Mm-hmm. So that's why it's so important. And that's a change in trend from what we saw in China or Asia or even Europe. Mm-hmm. That we're significantly seeing a new trend in the US.
So like you said, there are previous immunocompromisations that make more people be at risk than others, right? So what are some of these conditions that we have to look out for?
I would say like age above, they usually say age above 60 is high risk, but anything, I would say even a 50-year-old is at high risk. The other conditions would be diabetes, any kind of lung disease, like even smoking is a very high risk. Smoking is absolutely high risk. A lot of younger population that we're seeing, they are smokers. We'll look at the more data later on when we have more data, but we do see that they have some form of respiratory like issues, like smoking could definitely contribute to that. Then any form of chronic lung disease, like we call COPD, where people have some form of dysfunction of the lungs, asthma, some immunocompromised conditions like HIV, cancer, people who are receiving chemotherapy, people who are on steroids. Those are very, very high risk population.
As a medical professional, what advice would you give to ordinary citizens to go back to work post-quarantine and to their new normal?
That's a very good question, and that's what everyone is thinking right now while they are in the lockdown. There is this unknown fear of unknown and what's going to happen next, and everyone is anxious to get back to work. It's summer, we need to get back to our lives, have fun. um, the problem with this is that this disease and this whole thing is so new, and we really don't know much about it. And as a healthcare expert, what I see, or as an infectious disease expert, what I see is that this virus is going to stay for a while, until we have a vaccine or until there is a herd immunity. So it's going to take some time. And even though we say post quarantine, or what is this new normal, which we do not know, we'll see as we go, and there's no specific timeline, unfortunately. But it could look like until we have the what we call a herd immunity, where about 60 to 70% of the population is already infected, and that could take several months. Or we have a vaccine, and that again will take several months to a year. Until then, what a new normal would be, we don't know, but it possibly could be the opening up, or when the lockdown opens up, it could be potentially like a phased wise opening up, where essential businesses, important businesses will open up, and then slowly, if we do not see new number of cases rising, for that to happen, there has to be a very stable and low number of cases in the community or in the hospitals. Like New York City or New York Department of Health monitors the number of cases every day, right? So if they're going to see a huge spike next week, like significantly increase, they're not going to open it, because it doesn't make sense. But if they do see that there is a constant decrease in number of cases, then they will hopefully establish a good time, like guideline, as to what is going to open up. And we should listen to them. We should listen to what the health officials, what the government officials, what governor is saying. We should listen to them, because they are the ones to guide us, because there's so much unknown in this.
Right. Like, this is, like you said, nothing like we have ever seen before. So how are you coping with this wartime-like scenario?
It was very, very tough. And at some point, I felt like, oh my God, it's too much. I don't think I can handle it anymore. And the way I coped with it is, I cannot run. This is war. I cannot run. This is where what I do will be appreciated. And I speak to a lot of others in the medical community, or I speak to my family. I speak to people. It's possible to speak to people even though you are, thanks to the technology, right? I'm still connected to everybody by phone or by WhatsApp or by FaceTime. And I talk to other people in medical community, and everyone is going through this. So I felt like, okay, this is something that it's just not me. Everyone is going through this. And at this time, I will be able to contribute a lot, and this is required of me. It is my duty to contribute and do the maximum I can do. And that's what kept, me going. And it was very difficult. I would dream, I would wake up with dreams of my patients that I saw, or that patient that I lost. It happened to me. I would wake up with, like nightmares. But I started, trying to develop a schedule. I started to go back to this new normal, as we say. I in the morning try to get up, go through all the new journals, whatever is new today for the day. And then I talk to everyone in my group. I communicate with them. I come back home, talk to family. I try to listen to some music. I try to read books. And then before I go to sleep, I try to meditate. And then I try to take care of myself, because if I don't take care of myself, then I won't be able to take care of, patients or everybody else that are working with me. So it's tough time, but I think I have processed, and I'm still processing. And the thing that keeps me going is that, okay, everyone is in this together, and there is everyone who is feeling the same.
Thank you so much for sharing that. Just to conclude this interview, I would like to ask you some words of encouragement that you would like to share with our audience during this crazy crisis.
Absolutely. I would like to say that this pandemic is something so different and crazy and new to all of us that we have not, this generation has not seen this. Some of the experts and officials say compare this to what happened in 1918, the Spanish flu epidemic, which lasted until 1920, or something like World War I or World War II, which killed so many people. So this is like this world is at a war right now. And I think at this time each person has a duty to contribute something, reflect back, think what they could contribute at this time. It could be anything, but I'm sure there is something you could do at this time. When years pass and when you look back and reflect, you would think that you've contributed so much at those tough times, and you would be proud of yourselves, and you'll see that you came out of it better and stronger. That's what I would like to say.
Thank you so much. That's amazing. And again, I really want to thank you for taking your valuable time out to be here with me and talk to our audience and spread awareness about this. I hope everyone learned as much as I did today from this interview. And so thank you again.
Thank you so much again for having me. Take care of yourself, and everyone, please take care of yourself. Thank you.